The we divide acute myeloid leukemia into some broad categories. The first is AML that we see in children with Down syndrome. This is a unique subset of AML. It usually happens only in children with Down syndrome and before the age of 4 years of age. It requires special treatment different from what other children with AML who don't have Down syndrome will receive. And in general, the prognosis is quite good. The other rare type of AML, or another rare type of AML to consider, is acute promyelocytic leukemia. This is a very specific subset of AML that requires therapies other than chemotherapy, other than traditional chemotherapy. It's treated with medicines that are much less toxic than what we see in all other children with AML. And it's also associated with a very good prognosis. Survival in children that have acute promyelocytic leukemia, or APL, is close to 100%, even with much less intensive therapy. The next type of AML is pretty much AML and everybody else. We often call this de novo AML. The de novo AML is the type of leukemia that occurs in all other children, and this can be broken down into many different subgroups, often defined by the type of mutation that occurs. In general, de novo AML, unlike Down syndrome AML and acute promyelocytic leukemia, requires very intensive treatment. We also think specifically about relapsed AML. So this would be AML that's occurred after initial therapy. And the treatment for relapsed AML is different than what we see in de novo AML. The therapies are similar, but the approach is different. And nearly all of these patients will require a bone marrow transplant.